Have you ever imagined that in less than a minute, the brain, the place where your memories, emotions, and even the way you call your grandchildren's names are stored, could shut down forever? Every year, more than 800,000 people in the United States suffer a stroke, which means that every 45 seconds, someone is stripped of the chance to live healthily. The question is, if one day it happened to you or a loved one, would you have enough knowledge to recognize it and act in time? What terrifies many people most about stroke is its suddenness. It can strike while you're sipping your morning tea, chatting with your daughter on FaceTime, or even just dozing off for a short nap. People often call stroke a brain accident, as if it were some unforeseeable mishap. But I want you to understand a crucial truth. Stroke is never an accident. There are always underlying causes, and you have the power to prevent most of those risks. So what are those causes, and what can you do starting today to protect your brain? Before diving deeper into the mysteries behind this condition, I have a small request. If you truly care about your health as you age, if you want to learn how to prevent stroke and keep your heart, memory, and mind strong, hit the subscribe button right now. And so I know you're walking this journey with me, leave a comment. Type the number 1 if you found this information helpful. Type the number 0 if you think you don't need it yet. Could that small number you leave behind become the very reminder that helps someone in your family escape a life-threatening emergency one day? So what exactly happens in the brain when a stroke strikes, and why is just a few minutes delay enough to decide between life and death?
Explaining stroke and its risk factors. Did you know that our brain is the greediest organ in the body? It accounts for only 2% of body weight, yet it demands more than 20% of the body's blood supply to stay alive. If that blood flow is interrupted for just a few minutes, millions of brain cells die forever. So, what cuts off this vital flow? There are two main culprits that can shut down the brain. The first is a blood clot, blocking circulation, which medicine calls an ischemic stroke. The second is a blood vessel that bursts, causing a hemorrhagic stroke. In either case, the consequences are devastating. One side of the face suddenly droops, an arm becomes powerless, speech turns slurred or confused. Can you imagine laughing and talking with your grandchildren, and in just a split second, all your memories and words vanish? Stroke does not appear out of nowhere. It is like a fire that erupts from sparks smoldering in the body for years. High blood pressure, diabetes, high cholesterol, smoking, alcohol, all are like small flames slowly eating away at the blood vessels day by day. One of my patients, Mrs. Mary from Florida, a 70-year-old former elementary school teacher, thought she was just a little tired from aging. In reality, her high blood pressure and cholesterol had turned her brain's blood vessels into a ticking time bomb. Fortunately, hers was discovered early, and she began making lifestyle changes, but not everyone is that lucky. The question you need to ask yourself today is, how many flames are smoldering inside your body that you haven't noticed? And if most strokes can actually be prevented, why do we still allow them to claim hundreds of thousands of lives every year? So, how can we recognize the early warning signs before the brain has to cry out for help?
Early warning signs and deadly mistakes. Have you ever seen someone suddenly start slurring their words, or half of their face droop in an instant? That could be the golden moment to save their life. Yet so many people miss it, thinking it'll probably go away on its own. In reality, the brain does not wait for us. In neurology, we have a saying, time is brain. Every minute that passes means millions of neurons die, never to return. Would you risk your future by waiting and hoping for a miracle? To make it easier for the public to remember, health experts use the acronym FAST. F is for face, facial drooping. A is for arm, sudden weakness or numbness in the arm.
S is for speech, slurred or difficult speech, and T is for time, meaning call emergency services immediately. Imagine being with your husband or wife and suddenly noticing they cannot raise an arm or speak clearly. What would you do? Call 911 right away, or wait a few minutes to see if it gets better? One of the deadliest mistakes I see all too often is patients taking aspirin on their own, just as they would for a heart attack. This is extremely dangerous because not all strokes are the same. If it is a hemorrhagic stroke, taking aspirin is like pouring fuel on the fire. It worsens the bleeding and can take a life within hours. Do you know how many families have lost loved ones simply because of this seemingly harmless mistake? What troubles me most is that many patients arrive at the hospital far too late. They think their symptoms will fade on their own, or they don't want to bother others. But in reality, if they came early, we could use a clot-busting medication called TPA to dissolve the clot, or perform a thrombectomy using a catheter to physically remove it and restore blood flow. These treatments only work if you act within minutes. So why wait while your brain is crying out for help every second? And here's a question many people, especially women, often ask. Is stroke different in women compared to men? Could it be that because their symptoms are often milder, they are more easily overlooked?
Stroke in women. Why it's easier to miss, and why the consequences are often worse. Would you believe that sometimes women face more devastating consequences from stroke than men, simply because of their own resilience? I once met a patient named Linda, 65, from Texas. One ordinary evening, she felt a dull headache along with some dizziness. Instead of telling her husband or children or calling for help, she thought, "It's just fatigue. I'll be fine tomorrow." But the next morning, Linda couldn't complete a sentence, and half of her body would no longer move. She arrived at the hospital too late, and the result was that she had to live with partial paralysis for the rest of her life. Can you imagine the pain of a mother, a grandmother, who once cared for her whole family, now having to depend on others for her own care? The reality is that women often present with lighter stroke symptoms than men. Instead of clear paralysis, they may experience only headaches, fatigue, or slightly slurred speech. And because these signs are subtle, they or their loved ones often dismiss them, thinking nothing serious is happening. Even healthcare providers sometimes underestimate these symptoms. Doesn't it feel unfair that just a small act of dismissal often leads to worse outcomes for women after a stroke? The message I want to send to every woman is this: listen to your body. Never dismiss unusual changes, no matter how small they seem. Remember, taking care of yourself is the way you continue caring for your family. If you notice facial drooping, arm weakness, or speech changes, act immediately. You deserve timely treatment, and you have every right to it. But here's something that shocks many people. Stroke does not only affect the elderly. More and more cases are being reported in younger adults, even those in their 20s and 30s. So why is this disease, once thought to belong to old age, now striking people in the prime of their lives?
Stroke in young adults, a shocking truth and hidden causes. Do you believe stroke is only a disease of old age? The reality is shocking to many. I once witnessed a 32-year-old man, healthy, working in the tech industry, suddenly admitted to the hospital, half his body paralyzed. He had never thought he was at risk, because in his mind, stroke was something that happened to parents or grandparents. But the harsh truth is that familiar risk factors like high blood pressure, diabetes, high cholesterol, and smoking, once thought to belong to the elderly, are now attacking younger generations. Isn't it frightening that even those in the prime of life can collapse in an instant? And it doesn't stop there. Modern lifestyle factors add to the danger. Overuse of energy drinks, drug abuse, and even complications from infections like COVID-19 all can turn a young, vibrant body into a stroke victim. On top of that, there are rare heart or blood vessel conditions that young people may not even know they carry. Can you imagine the heartbreak of a family when their son or daughter, just in their 20s, ends up in a wheelchair because of an unexpected stroke? Yet, amid the fear, there is hope. I have seen many young patients recover remarkably well because perseverance and youthful strength help them overcome the aftereffects more quickly. This reminds us that at any age, prevention is the key. Because once you take control of the familiar culprits, you dramatically reduce your risk. So how can stroke be effectively prevented, not just for the elderly, but for young people too? Is there a simple formula anyone can follow to protect both brain and heart? Have you ever wondered, if most strokes come from underlying causes, why can't we stop them from happening in the first place? The answer is, we can. After decades of research, the American Heart Association has introduced a very simple formula called Life's Simple 7. 7 small steps powerful enough to change an entire life. Are you ready to hear this secret? The first step, quit smoking. It sounds familiar, but did you know that just by giving up smoking, your stroke risk drops by nearly half in only a few years? Next, control your blood pressure, because high blood pressure is the silent killer that quietly damages brain vessels every single day. Are you checking your blood pressure regularly each week, or do you only wait until you feel dizzy to measure it? And then there's diet. Instead of thinking of it as strict deprivation, imagine meals filled with leafy greens, fish, and whole grains as the sturdy bricks building strong, healthy blood vessels. Wouldn't you want to add more healthy years to your life with your children and grandchildren, simply by changing what's on your plate each day? Don't forget physical activity. Just a brisk 30-minute walk each day, 150 minutes a week, is enough to make your heart and brain thank you. And if you manage your cholesterol, blood sugar, and keep a healthy weight, you'll hold the complete golden key to preventing up to 80% of strokes. Do you think those 7 steps are too hard, or are they really just about starting small? Taking a walk this evening, skipping a soda, or picking up the phone to schedule a checkup? What I want to emphasize is this: aging does not mean illness. You can still live happily, healthily, and fully if you know how to take care of yourself. But how can we turn fear into hope and knowledge into action, starting today? You see, stroke is not some random accident that suddenly strikes. It's like a silent thief, patiently stalking through daily habits, through each cigarette, each salty meal, each unchecked blood pressure reading. But you hold the key, because when you understand the risks, recognize the warning signs, and act quickly, you can change the future for yourself and your family. Do you want to let the brain, the place that holds your memories, your love, your laughter, be stolen because of neglect? Or do you want to protect it so you can keep living strong with your loved ones? Remember, stroke can be prevented, treated, and overcome. You are not a victim. You are in control of your health. Every walk, every healthy meal, every blood pressure check is another brick in the wall protecting your brain. And I believe that if you start today, you will not only live longer, but live a more fulfilling life, one with more laughter and less fear. So will you choose action, or will you choose to wait? Will you let time slip away, or will you turn it into the opportunity to save yourself and those you love? If you found this video helpful, click like to spread the message further. Hit subscribe so you won't miss other important health knowledge. And don't forget to leave a comment. Type 1 if you've learned something today that could change your life. Type 0 if you feel you're not ready yet. Who knows? Your comment today may be the reminder that helps someone else recognize the signs and act in time. We can't turn back time, but we can take charge of this very moment. And this moment is your chance to defeat the stroke.